morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. Friends, in this episode, I am going to concentrate on the common signs and symptoms of a diabetic. How to know or identify a diabetic patient early by talking to them. And the signs and symptoms are also, there is a mild variation in the presentation between type 1 diabetes and type 2 diabetes. So first, I will concentrate on the commonest type of diabetes. It is more than 90% of diabetic are type 2 diabetic and only less than 10% are 1 to diabetic patients. So in type 2 diabetes, the commonest symptoms are, all symptoms are due to hyperglycemia, and this hyperglycemia affects almost all the trillion cells from head to foot. So as a diabetologist, when we see a patient, just by examination closely and physical signs, looking for the hair's health, the texture of the skin, the color of the skin, the muscle firmness, the robustness, the aggressiveness, the activeness, everything will be gone once a person becomes a diabetic. The hair loss is present, hair is dry and coarse, it's no longer healthy, skin texture that will go, the person's skin will be dry, they will have sunken eyes, and they won't feel fresh, they won't have the mood to do bigger things, they will be always tired looking, fatigued individuals. So just by the look of them, the way they walk to the clinic and come and sit in front of you, we can identify whether the person is an established diabetic or not. Then number two, we talk to them. Invariably, the history or the complaint they say is, sir, I feel very tired nowadays. I don't have the energy to do my routine work anymore. Especially in the evenings, I feel like getting to bed early. They feel very sleepy. They are very tired, fatigued individuals, feel worthless. They're not able to carry on with their routine. They don't have the drive anymore. Then next, the most important history they have, they give is, they feel very much hungry, especially towards the afternoon. Morning breakfast, they will have a normal breakfast. And by around 12:30, 12:45, they will have an irresistible urge to eat. They won't be able to carry on with the routine. The hunger is so much that they start getting tremors. They feel very much tired. They are not able to pull along. And once they go and sit in front of the plate, the way they eat itself is different from normal individuals. They used to have their food in bulk rapidly, and within few minutes they will finish off everything that is kept in the plate. So the way they eat is an early sign that they have become an established diabetic. And after having food, they will sweat profusely. They will have that extreme fatigability, and they would like to lie down for a few minutes, and then only they can carry on with their routine. That feeling of what is exhaustion. Exhaustion is present after the bulky meal they take. So that is the common symptom with which a diabetic comes. Then the three classical signs of diabetes, namely polyuria, polydipsia, and polyphagia. Polyuria means excessive micturition, or going to toilet urinals for more than 3 to 4 times, noted especially in the night, that is called nocturia. Because in daytime, in the routine, when they go around, they won't be able to notice it, even if they have polyuria. But after going to bed, if they are disturbed in sleep 3 to 4 times, it becomes considerably noticeable. So nocturia is the classical symptom of an early diabetes. So you should alarm that he may have a diabetes and start examining his blood sugars, urine analysis for urine sugar. The cause for polyuria is glycosuria, excess glucose in blood getting filtered, reaching the renal tubules. The loss of glucose in urine is called glycosuria, as you all know. More the glucose in urine, glucose acts as an osmotically active substance. It attracts water along with that, so they pass more urine. So classical triad in a diabetic is polyuria, especially nocturia. Number two is polydipsia, as I said, that is excessive thirst. Lack of glucose entry into the osmoreceptors of hypothalamus induces excessive thirst, so they drink more water, plenty of water. It is another classical history. Third one is polyphagia, where there is an excessive hunger. There is an irresistible urge to eat. They don't have satiety. This I've already pointed out. Either there is leptin resistance along with insulin resistance, or there is a defective leptin that is produced by adipocytes in obese individuals. There is no satiety for them, irresistible hunger, they eat more. The another cause is whatever they eat is converted to glucose, which should be used as a fuel to the cells. To enter into the cells, glucose requires the presence of insulin. In them, in diabetic, there is either a lack of insulin or a lack of action of insulin. Both of them doesn't drive glucose into the cell. So all the cells are starved of this vital energy. That is why they feel that extreme fatigability, tiredness, somnolence, etc. Then these diabetic patients, before they come to you, almost 10 years or 5 to 6 years at least would have elapsed. So they start getting complications in the form of retinopathy, nephropathy, neuropathy, and signs and symptoms of that also they come when they come to the clinic. Say they complain of blurring of vision, then they complain of burning sensation or abnormal sensation in both feet, especially at night, which is called paresthesia. They also complain of they give a history of passing frothy urine, which suggests microalbuminuria, a presence of albumin in urine, which is the earliest sign of diabetic nephropathy. These are the common signs and symptoms of a type 2 diabetic, who is usually an obese individual, who is reluctant to move, who is fatigued, who eats more, and who complains of lack of attention or concentration, lack of vigor. And there is also history of erectile dysfunction, which is very, very common, especially in an obese diabetic, which is due to microangiopathy affecting the blood vessels of external genitalia. So all these things you should have in mind, and then once you get these kind of history from the patients, you should immediately go in for other investigations to prove that they are diabetic. Next, in type 1 diabetes, which is common in children, the most common presentation is a failure to thrive. That is, they are not able to achieve the normal growth both physically and mentally. So they are very poor in studies, academic record is less, they are dull children who are reluctant to go out and play, who are always feeling sleepiness, they don't concentrate well in the class, and they suffer from history of repeated viral infections. That is, the incidence of seasonal infections are more in them compared to other individuals because of lack of immunity, and they are usually very thin. The muscle mass is less thin built individuals, and most common history given by parents of children is they come to the clinic with the history. The child goes in for episodes of loss of consciousness frequently. This unexplained loss of consciousness for 2 to 3 minutes could be mostly due to diabetic ketoacidosis in a type 1 diabetic. And if you see the blood sugar, invariably it will be very high, and the child would have gone in for ketoacidosis. That is why there is history of loss of consciousness. So if a person, whether a child or an adult, comes to you, look for the following signs and symptoms. Especially in adult, look for the healthiness of hair, look for the skin, and also look for blackish pigmentation in the nape of the neck, in the axilla, which is called acanthosis nigricans, which is a sign of insulin resistance in an obese individual. So any individual who comes with abdominal obesity and more BMI, then with the history of fatigability and passing more urine at night, don't fail to do a fasting and postprandial blood sugar and HbA1c, which will help you to diagnose and treat them early. Thank you.